I don't know about you, but I work really hard, and sometimes work so hard that my brain might hurt. And one of my favorite techniques that I enjoy going for treatment for is craniosacral therapy. It just seems to relax my mind. And I thought that I'd share that with you. And today I'm talking to a craniosacral therapist who's based in London. Her name is Amal Alaoui. She does other things as well, but we're talking today about this beautiful technique. But before we talk about what it is and how it helps with stress, I'm going to ask Amal what it is that stresses her out on a day-to-day basis.
Hi, thank you for inviting me. Well, the thing that really does stress me out, I think most of all, is having to deal with technology. And I think when you invited me to be part of this, initially I thought, oh, no, I didn't want to do it. Anything to do with videos, YouTube, all those things, I have very successfully hidden away from. But it's been on my list that I sort of face the fear anyway, do it and face the fear. So here I am
Oh,
doing
wow.
this. But I think anything, if the internet goes wrong, and I know I share this with a lot of people, but
Yeah.
it brings something up in me where sort of craniosacral speak, but my nervous system will go into the sympathetic state just like that, very, very
Yeah.
quickly.
Well, we'll find out what that actually means in a little bit. So yes, technology, I'm a little bit the same, but I use a lot of technology and lots of different things for different things. That's so helpful. I'm sure everybody understands exactly what I'm talking about. And what I find is that they change the way things work really quickly without notification. So you think you know how to do it now, and then they've changed how it works. So you have to kind of relearn something that you thought you'd got down. So it can be very frustrating. And if you're time limited as well, which I am, it can be super frustrating. So are you saying that your technique is either to avoid or just go for it anyway? Because you've kind of gone for it today, haven't you?
Yes.
Yeah.
I think, like many people, my default button is, oh, no, won't do that, avoid
Yeah.
it. But my philosophy is very much about empowering my clients.
Yeah.
So obviously I have to walk my talk.
Yeah.
So eventually I will think, well, this opportunity has come, there's this, and what is frustrating, I think, is when you actually realize that you can feel very debilitated by a fear or a reluctance to do something new and come out of your comfort zone.
Yeah.
And I've seen that in clinic, that can make people really become quite unwell, where they have the aspiration, the dream, the desire to do something, myself included, but there is something holding them back. So, and I think it really is important that we fight through that when we're ready and with support.
And so rather than fight, kind of embrace this kind of new experience, I think is another way of looking at it. But I like to talk about the comfort zone not really being very comfortable. It's just something that's familiar, but it's actually incredibly restrictive. And one of the ways that we get joy from life is a sense of achievement. So when we've done something that we didn't think we could do, and I was massively camera shy. I'm not massively camera confident now, but I just think, you know, I am who I am. I make the mistakes I make. Nobody's died. I just carry on anyway, because I want to know that I'm helping people. So to me, certain things were limiting me from being able to help. And that's, I guess, implied in what you're saying there as well.
Yes, I think it's a fantastic approach that you've mentioned that you use all the time. And at the moment, I think I feel some kind of discomfort, as you've talked about. That's when I just think, what's this about? Let's have a look at this. So for me, it's technology and also motorways. I don't like motorways.
Oh, interesting.
But I overcame that because of a desire to want to do something a year ago. So that, and I managed to get on a motorway, do 300 miles. And yes, it's very, very liberating once you've work through that.
That sense of achievement. There's a lot of people with a fear of motorways, actually, but anyway, story for another day. Okay, so let's talk about craniosacral therapy. I did have a therapist, by the way. He used to come to my home, and he was terrific, but he moved away to Manchester, so there's no way I could have regular sessions, but it is such a good technique. So what is it, and how does it actually help with the stress levels?
Well, craniosacral therapy is, I think it's incredible in terms of what it can shift, what it can do. A lot of people may have heard of it the first time they become a parent, and their GP may refer them to a craniosacral therapist for the baby if the baby had a difficult birth, but it's so effective for everybody: men, women, young people, the elderly, those convalescing. And it's a body treatment, so it's working through the body. You remain fully clothed, and we're basically tapping into the very light, gentle touch, and listening. It's been called listening to the body. That's one way of expressing it. But you're listening and taking note of any restrictions that you can sense within that body, and also looking at old patterns. Sometimes if a baby came into the world and they were stuck in the birth process, that can continue all through their life unless they have, and they may not notice any difference, but they can develop different types of pathologies with that. So it works through the cranial system, which is the system that's closest to your nervous system.
So cranial, is that the skull?
Yes, the cranium, which is the skull. So we have all these cranial nerves, then obviously the brain, we have all the hormones there, also the facial nerves here. So many people come for dental issues, they've got trigeminal nerve issues, if they've had dental work, or if they grind their teeth at night, all those things. So all these delicate facial nerves working around the eye, orbital bone area as well. What you're doing, you're noticing where the tensions are and helping to facilitate any alignment that needs to take place. I always say to clients, all that I am trying to do is to help you be put back together again, in terms of helping you feel balanced. And by that, I mean feeling aligned. And when we feel aligned, that's a pretty good state to be in as a human being.
Absolutely, yeah.
But we don't really want that sort of utopia and, oh gosh, like this. But you can feel amazing when you connect back to yourself. And that's what craniosacral therapy can do. And it could take one session, it could take several sessions, and you're noticing just any shift. So the cranium here, all that side of it, and then what we have is the spinal cord, so all the spine, that then connects down to the sacrum. So it's all the hip area, the sacroiliac. So if you look at the spinal cord from here to there, all the vertebrae that go down there. So people come for back problems, neck injury, whiplash, shoulder pain. Some people come for IBS or other stomach issues. Definitely.
I didn't know.
If you think about it, Tessa, that we basically got all these organs that are housed around the spinal cord.
Yeah.
Of course, and they do all communicate with each other.
Yeah.
So when there is misalignment, things get stuck and cramped. If we have to work on the liver, all those or the spleen, the gut area. If I have somebody who's got very tight, I might sense that they're very tight in the lung area, then I will work around here and helping to expand the lung area.
So it's a long time since I had it, but my memory of it is so gentle. It's almost like the person isn't doing anything, and yet you do feel the relief. So what is actually happening when you say you're doing that? What is it you're actually doing?
Well, one of the techniques is that we, craniosacral therapists, we're palpating. Now, we have to remember that craniosacral therapy was formed or discovered by an American osteopath, and many, many, many years ago. And he identified that actually you don't just work on the bones. In fact, I seldom work around bones, but what we have is that we have these sutures and we have all the nerves, which I've explained. And then with that, we also have memory and muscle, the fascia. So sometimes you could do a fascia release. So hands are placed very, where am I? Very carefully, could be on the occipital bone, which is just there. So with that, with the sort of, I won't get too technical, but with the occipital bone at the back of the head, we have a great big hole at that part of the head called the foramen magnum. And through that hole, we have all these cranial nerves that pass through. So I'm basically looking, if I go to that part of that person's body, I'm looking to see if there is any tension there, agitation, and they may actually have come because they've got pain here that won't go away, which could have been the result of Zooming with clients for too long or using their mobile and doing this. You know, I've got an elderly client in her 70s. She's like this all the time and she's so short-sighted. So clearly that's going to have an impact. She couldn't make the connection, and why would you? So I would work around that whole area. If somebody comes for migraine,
when you're working around, what is literally happening? So around here, what is it you're literally doing?
Holding the hands, and you're releasing, you're helping to release through gentle touch, palpating, going through and calming the nervous system.
Okay.
The nervous system, it is quite difficult to verbalize. I find it easier writing articles about it. Just one of those things.
Yeah.
But if somebody comes for migraine, you know, it may be that I have to work around here, or if there's so much tension, most people that I see will come and you find that they're stressed, however you might want to define stress and how that stress is manifested.
IBS and migraines are presentations of stress, aren't they?
Yes, yes. So it could be for those things. And then sometimes you will just work lower down the spine. Post birth, giving birth, a mother may come because her hip area is misaligned. So you need to work very, very gently there, the back of the spine.
Let's focus on the stress part. So it works by palpating.
Yes.
The word that you
To release an old pattern, or a pattern that the body has put itself into.
And it's simply holding, and that is the palpating.
And tuning in. You're tuning in.
I see.
Which you learn through training. So you're basically connecting, and it's very subtle, but you are observing the fascia, you are observing fluids. A lot of the work that craniosacral therapists do is looking and identifying what's going on with that fluid. So we have from the brain cerebrospinal fluid, a CSF, and that goes from the brain. It's there all the time, the moment we're conceived until we die. And that's running down the spinal cord as well. And I'm looking at the rhythm of that. So I'm testing and trying to sense what's the speed of that cerebrospinal fluid. Is it running up and down very quickly? What's the quality of it? So does it feel, I mean, one word that you can use is sort of sparky, electric, and that will sort of indicate perhaps that the nervous system is quite frazzled. Or is it very soft and too soft almost, and almost like not there, where that person, if somebody who may come for chronic fatigue, post infection, post viral, low, you know, lethargy is just so bad that they need their energy restored.
So it's less of a manipulation, more of a cradling with energy.
Yes, palpating, and that's the term, which every craniosacral therapist, I suppose, like every practitioner, has their own way of defining things, but I actually follow the thought that it is gentle manipulation.
Okay.
I'm not cracking bones. I'm not qualified to do that. I don't want to do that. I wouldn't know how. But it's gentle manipulation, which is the palpating. So
I see.
Palpating through the system, the cranial system. So, and it works. You can see on a baby, you can see babies can be very stressed. So So, you know, they're not worried about paying the mortgage or their education, but they may have come into the world by, yes, and quite traumatized. So, and that will manifest in poor sleep routine, not feeding well. That's just quite a basic layer. But then the older you become, you have layer upon layer, and that produces stress. And I'm looking at how that person shows their stress. And a big part of it is in their breathing. And most people, we don't know how to breathe. We just,
I know.
we have to be reminded. And so that's, I think, why meditation is becoming so popular, and yoga. And I do a lot of breath work with clients. It's one of the things I use for myself when I'm feeling panicky and if I'm running late for something. But so, and just really helping people understand the power of the breath. I mean, it's super powerful. If you think without breathing, well, there isn't much point, is there?
Well, there won't be for long. Yeah, so the way we breathe, that would I'll probably do another talk on that another time. Okay, that's so helpful. Thank you ever so much, Amal. And at this point, I always ask my guests if there's a book that they've read that they found helpful, enlightening, uplifting, and to see if that other people might feel the same way. So you have a particular book in mind, don't you, Amal?
Yes, I've got this beautiful little book, which I grabbed while I was at work just over a year ago, actually just before lockdown. And I was
title for us.
Yes, it's Gift from the Sea,
right.
by an American author, Anne Morrow Lindbergh. She actually wrote this in the 1950s. This copy, I know, but it's so relevant for today. It probably actually more so. And this production edition was written decades later by her daughter. And in it, she talks about how people need to find, the most important thing is solitude.
Yeah.
And this isn't talking about being alone, or loneliness, but this is something I find in clinic a lot, that people come, they're so frazzled and busy because we identify success by how busy we are. But with this book, it reminded me, there are reflections about how the author, she was bogged down in the 1950s with loading the dishwasher, the washing machine, all the domestic chores that she had to deal with, and really wanting to become a great author. So the only way she recognized how she could connect with herself was to find solitude. For her, it was going to her place by the sea, which would be wonderful if we could all do that. But she looks in this, it's beautifully written, she looks at different shells and different aspects of the sea and the beach that reminded her of different parts of who she is. And I just found it, extremely comforting. I think Emma Thompson says it's something that everybody should read.
So it's interesting because as we're recording this, and I didn't want to make this about lockdown, but we are in lockdown at the moment, and a lot of people are solitary in an enforced way. But this is a different message, isn't it? It's about being alone to connect with yourself and who you really are. Yes. So that is looking at it in a lot more depth about the benefit you can get from the quality of that solitude rather than simply waiting for.
Exactly. And I think in my clinic with cranial work, this is why I find it so effective, so powerful, is the fact that you learn to listen to that person, and what happens is they learn to hear their body.
Beautiful.
And that's such an incredible thing, that they go silent, the body becomes silent. And when I say body, obviously this is a holistic treatment, it's all of you, the physical, mental and emotional. When we can find silence, we can hear and connect with our body, with ourselves more effectively, and actually you become more creative.
Absolutely. No, I agree. Thank you so much, Amal. I've really enjoyed chatting to you today. I hope you have too, and you found some benefit from learning about craniosacral therapy and the other things that we've spoken about today. If you have, do please like and share and comment below. Maybe you've got some techniques that you'd like to share with the other viewers. And if you haven't subscribed already, please do that too. Thanks for listening. Take care.